Please remember from my first video there are 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 sacral vertebrae, and 4 coccygeal vertebrae. In adults, the 5 sacral vertebrae have fused to form the sacrum. The 4 coccygeal vertebrae have fused by the age of 30 to form the coccyx. Just by looking at these vertebrae here, you can tell that based upon the region in the vertebral column you're in, the vertebrae will vary in size and their individual characteristics. A typical vertebrae contains a vertebral body, a vertebral arch, and 7 processes. The vertebral body is massive and faces anteriorly towards the abdominal cavity. This area of the vertebrae is large due to the fact that it supports the body's weight. Starting at about the T4 segment moving inferiorly, the vertebral bodies increase in size all the way to the L5 segment. The L5 segment of the column has the largest vertebral body. At this point, the weight of the body is distributed to the sacrum, to the coxal bones of the pelvis, to the femurs, and then inevitably transmitted to the ground. The vertebral arch is comprised of the cylindrically shaped pedicles, which project posteriorly off of the vertebral body, and the blade-shaped laminae, which come together to meet in midline. Appreciate that the vertebral body, the pedicles, and the laminae create what's referred to as the vertebral foramen. All of the vertebral foramen collectively are known as the vertebral canal, and the vertebral canal contains the spinal cord and its protective membranes or meninges. At the junction of the pedicles and laminae, we find large transverse processes which project posterolaterally. At the junction of the 2 laminae posteriorly, we find the spinous process. The transverse processes and the spinous process are important points of muscular attachment, particularly for the deep muscles of the back, which are concerned with the position and movement of the vertebral column. Appreciate that each vertebrae also has paired superior articular processes and paired inferior articular processes. Each pair of superior articular processes will articulate with the inferior articular processes of the superior adjacent vertebrae. These articular processes articulating with one another form zygapophyseal or facet joints. Also, the pair of inferior articular processes of this vertebrae will articulate with the superior articular processes of the adjacent inferior vertebrae. I hope that makes sense and that you really enjoyed this video. Thank you.